Hello and welcome to Spotlight on Migraine by the Association of Migraine Disorders. I'm your host, Molly O'Brien. Let me ask you a question. When you have a migraine attack, do you typically feel the headache pain on one side of your head? Well, as it turns out, which side of your head you feel that headache could mean something. Today, we're going to talk about the differences between left and right migraine. To help us learn more about this fascinating topic, I'd like to introduce our guest, Dr. Adam Sprouse-Blum. Dr. Blum is an assistant professor of neurological sciences at the University of Vermont. His current research centers on understanding migraine pathophysiology through both human and animal studies. Dr. Sprouse-Blum, thanks so much for joining us today.
To be here.
A couple years ago, you started looking back at what science actually knew about migraine attacks and where that headache pain occurred. Fascinating. I'd never even thought that it would matter before. So, really excited to have you today. You've published a few papers in the past few years. So, let's dive into what you have learned. Before we do that, can you just explain to us what it means to have left-sided migraine versus right-sided migraine? What does that even mean?
So the first thing to know about this concept of left and right migraine is it's a bit of a misnomer because, in most people's mind, they think migraine equals severe headache. But in reality, all of the symptoms of migraine are just as much migraine. So sensitivities to light, to noise, to smell, nausea, brain fog, cognitive impairment. And so all of those symptoms are just as much migraine. But for the purpose of what we're talking about today, we did use the headache side as kind of the different to group people into people that experience typically left-sided headache and people that experience typically right-sided headache.
Let's dive into the right side first. For those people out there who experience headache pain on the right side of their head, what do we know? What did you learn from your research?
So we did this review of existing literature. So what have people published on people with right migraine and left migraine? And so we, in a standardized way, and we work with the medical librarians, and we pulled more than 5,000 papers that met our initial sort of poll of trying to find these papers. But at the end of the day, we ended up with just 26 studies out of more than 5,000 that met our criteria and talked about people that we felt had either left or right migraine. And so for people with right migraine, and these studies were across, different groups of people doing the studies using different testing modalities and instruments and questionnaires and such. But people with right migraine were more likely to have depression, perform worse on certain types of cognitive testing, have impairments in a certain type of memory called visuospatial memory, had some asymmetry, more likely to have asymmetry in their pupils, changes in their what's called the fight or flight nervous system, changes in blood flow in certain arteries of the head, and changes on EEG, so electricity, electrical activity in the head. So people with right migraine, those were kind of the findings that were sort of grouped with people that experience right migraine.
So, what do we know about left-sided migraine?
So from that same review that we did, findings in people that had left migraine was associated with more depression. Remember, right migraine in another study was associated with worse depression. So you have separate studies showing conflicting results there. Left migraine was associated with worse anxiety, bipolar disorder, and PTSD. Other changes in that autonomic nervous system as well. Science accumulates over time. You need multiple studies showing similar things, and you got to check the weight of the evidence. Looking at everything together, what do we see? And so my take home from doing that review wasn't about these specific findings. It was more that there appear to be differences between these headache lateralities across multiple domains using multiple instruments. And that caused me to want to, go deeper with this.
There could be some differences here. That was kind of the takeaway message. Do you know why that might be? Why we might have these differences?
So the study that we're working on the manuscript for right now is we were trying to get at that, are there brain regions, for example, that are active in people experiencing an attack, which is on the left versus the right in terms of the headache. And we did actually find differences, using functional MRI, so taking pictures of activity in the brain. We actually brought really nice people who are having an attack with just left-sided or just right-sided headache into the MRI Research Center here.
That's
And
brave of them.
I know. And it was
Wow.
actually before, and they actually withheld taking their acute pain relievers until after their MRI. So it wasn't a fun study to participate in. But yeah, the long and short of it is that we do see some brain regions that light up specific to either left or right-sided headache. And we're going to have to dig deeper to understand what that means. So is the physiology, the pathophysiology of migraine even a little bit different maybe in these two lateralities? Yeah.
Do we know anything about the differences, possibly the symptoms or what people experience when you compared the two groups?
We had the question of whether the attacks themselves differed. And so I work at the University of Vermont Headache Clinic, and we pulled um, 20 years of our patients diagnosed with migraine. And so we had more than 5,000, people that had been seen through our clinic diagnosed with migraine. And then each patient that is seen in our clinic completes an intake questionnaire, and there was two questions on that intake questionnaire that we used to group people into left or right migraine. And one of them was you had to draw on a three view of the face where your symptoms typically occur. And so we got people that only drew marks on one side of the head and face. And then there was a second question about whether you have symptoms that are just typically on one side. And so out of more than 5,000 people, we were really stringent to find people that seemed to exclusively have headache on one side because we didn't want, think about it. While 50% of people have headache, which can be worse on one side during attacks, that's not the most common form of migraine. I mean, we didn't talk about it, but the word migraine is actually derived from the Greek hemicrania. So, people knew from millennia ago that there's something about migraine, the headache of migraine, that is one-sided. And like I said, about half of people have headache worse on one side, but that's not the common form. So a lot of people have right-sided headache 25% of the time, left-sided headache 25%, and 50% of the time affecting both sides. Or maybe it starts on one side and then becomes bilateral. And so how do you group? So in our study, we were trying to differentiate, say, does a left and a right migraine attack differ? We were looking for people who pretty exclusively just had attacks where headache was just on one side. And sorry, I'm going long-winded, but the take home when we looked at the two groups is there was really almost no difference. But there is a little excitement. So there was no difference in light sensitivity, no difference in noise sensitivity, no difference in nausea, no difference in the presence of aura. So a lot of these symptoms, but you know what there was a difference in? There was a difference in the number of days with headache and the number of severe headache days. And we're not talking a really small difference. People with left migraine had more than 25% more severe headache days per month than people with right migraine.
Wow. That's wild.
Yeah, it's unexpected.
And you account for a lot of factors. You said you're pretty stringent. So I'm just trying to think, do we know why that is yet? Do we know why people who have left migraine have more headache days? Or is that still to come?
Let me clarify one little thing. So we did actually look at most severe pain score on a scale of 0 to 10 and typical pain scale on a scale from 0 to 10. So those specific factors didn't differ statistically significantly between left and right migraine.
Okay.
However, severe headaches did differ. Left migraine having more severe headache days than right migraine. We did notice, even though none of these findings were statistically significant, that all of the measures that we looked at, there was one, two, three, four, six additional measures, including headaches causing a change in plans, most severe typical pain score, attack duration lasting more than a day, and two measures of headache migraine-related disability. In all of those cases, even though they were not significantly different, all of them favored left migraine as having a more severe sort of type.
Hmm.
And so my my impression is that left migraine may have a more severe type, but it was only we were only able to detect that statistically in the number of severe headache days and the
Okay.
number of total days. But in response to your question about, sort of why this exists, we don't know, is the short answer, but we also don't know if this finding is specific to left versus right migraine versus left versus right sided pain more generally. So for example,
Interesting.
the left hand is more sensitive to painful stimuli in studies than the right hand. And also, after stroke, shoulder pain is more likely to be chronic when it occurs on the left. And chronic neck and low back pain was associated with worse quality of life in men when it occurred on the left. So there's not a lot of other data points that we can pull from, but from the data that we do have, there might be something there as to pain occurring on the left, whether it be specific to migraine or not, having kind of a worse experience than occurring on the right.
Really interesting. Okay, let's talk a little bit about treatment. Do we know if people with left or right migraine respond to any treatments differently, or if treatments might be more effective for people who have migraine on either side?
So this is a question that I would really like to know the answer to as well. So we don't know the answer to that question. We do know that there's been several studies showing about five different medications where they found that people that had unilateral headache compared to bilateral, both sides of the headache, where unilateral was more responsive to treatment than bilateral headache
Oh.
across multiple medications. But then they didn't further look at within unilateral headache, did left versus right, for example, respond differently to treatment?
Okay, that makes sense. So now that we kind of have a better understanding of all of this, and you've done a great job putting things into context, what does that mean for people out there? If there's folks out there who have right migraine, what does that mean to them? And what does it mean to providers? And what does it mean to researchers, I suppose? I feel like down the line, there's a lot more that we can learn from this.
Two areas are important from this research. One of them is that we shouldn't assume that migraine with headache occurring on the left is the same, is just a mirror to migraine with headache occurring on the right. And so when we perform studies in people with migraine, we should think about the side of headache. This is also relevant for medication studies, for example, when people are treating attacks. It's probably useful to add to the questions that they're being asked where on the head they're experiencing the pain, because it would be really interesting if we in the future found that, for example, one headache laterality was more responsive to either, a class of treatment or a specific treatment. The other thing that's, I think, going forward going to be interesting will be whether the pathophysiology, so the underlying things that are happening in the brain and other parts of the body in the nervous system differ by headache laterality, and whether these findings actually are more part of a more general pain processing of, think that people are familiar with language processing being on the left, but the brain, even though if you were to look at the two hemispheres would look pretty similar, there's actually a built-in asymmetry intentionally. It's more efficient to kind of have, there's a lot of duplication, but having kind of one process primarily occurring on one side allows you to be more efficient than have kind of, dual parallel processing. So, yeah, we don't know if this is going to become kind of a more pain, left-right pain thing, or if it's specific to left-right migraine. So, to be determined.
To be determined. Do you think it could be valuable for patients out there if they're meeting with a neurologist or healthcare provider or whomever it is? Do you think it's important to mention, hey, I have primarily pain on my right side or pain on my left side? Do you think that can be valuable in the future to help a patient out?
Yeah, I'd say not yet because, we don't know yet if the treatment might be, it'd be nice to have kind of tailored treatment to one headache laterality if that ends up becoming a thing. But right now we don't know it to be a thing. And I think it's more of a personal knowing that it'd be interesting for people, I guess, to start thinking about whether their attacks that occur on the left versus the right differ for themselves, uh, recognizing that there may be some underlying basis for that, for those differences that they're experiencing.
You've also recently published one additional study that looked at white matter hyperintensities in people with migraine and the relationship on which side of the head um, their migraine pain was. What have you learned? Have you found anything? What do we know so far?
Right. And so that study that we did where we pulled, thousands of people with diagnosed with migraine from the headache clinic here, we realized that a lot of those people had undergone MRI at some point in the past. And so it got me thinking, it's long been known people with migraine have these white matter hyperintensities, these kind of white spots, if you look at them on the brain. They're not thought, I don't want to cause any alarm, so they're not thought to cause any symptoms in migraine. In fact, they can be helpful in making a diagnosis of migraine if you have a young person that doesn't have sort of the other causes of those white matter hyperintensities, things like high blood pressure, diabetes, or smoking. And, a young person that has those often has migraine. And so I got to thinking, we have this kind of subset of people that pretty strictly has migraine with headache just on one side or the other. Maybe we should look at their MRIs and see if the location of those white matter differed on their imaging. And so about half of the people we had an MRI in their records. And then when we compared, what we found was surprising to us. We found that people with left migraine had more than 50% more of those white matter hyperintensities. And it wasn't sort of left headache, left location of those hyperintensities or the opposite side. People with left migraine had more than 50% more of those hyperintensities on both sides in both hemispheres than people with right migraine. And that again was surprising to us. We don't know what it means. I know obviously the next question is, well, what does it mean? So, like I already said, white matter hyperintensities in migraine have not been associated with any symptoms. And so in more common forms of white matter hyperintensity, such as due to high blood pressure and diabetes and smoking cigarettes, they are associated with dementia and stroke. But cognitive impairment has been looked at as it relates to these white matter hyperintensities and migraines, and that association has not been established as of yet, and not as much is known about stroke as it relates to white matter hyperintensities in migraine. So while we see this difference, I would say it's more scientifically interesting at this point. We have no correlation with anything dangerous or any anything else. But I guess it does provide further evidence that there appears to be some underlying pathophysiologic difference between migraine with typically left. And again, the other thing I should re-mention is that, this subgroup of patients that we studied, it's not patients, people might be thinking for themselves, oh, I get right-sided or I get left-sided attacks sometimes. This was, this is like 5% of our group where it was really headache almost exclusively occurring just on one side of the head. And that's not a very common subset of people with migraine. And so, we studied that subset because we wanted it to be pretty clean in terms of looking for these differences with the concern that if you had half the time on one, that it would kind of dilute any differences we might see. And so our findings, while interesting, they don't apply to most people that experience migraine. So at this point, I'd say it's more scientifically interesting than clinically relevant.
It seems like there are differences. So who knows, maybe down the road, people will maybe there'll be two different types of migraine before we even have all those subsets, or maybe there'll be additional ones. It's really interesting.
Absolutely.
Dr. Sprouse-Blum, thanks so much for joining us today and sharing all of your knowledge.
This was fun. I hope it was helpful.
Yeah, well, thank you so much for joining us today. I learned a ton. It's super fascinating topic, and hope we have a lot more to hear from you in the future about this and other research you're working on.
See you later.
This podcast is made possible by supporters like you. If you enjoy our content and would like to hear more, you can make a tax-deductible donation today at migrainedisorders.org. That wraps up Spotlight on Migraine. I'm Molly O'Brien. We'll see you next time.